Let's talk about our next anti-aging secret weapon here, exercise. This is perhaps overall the most potent of anything that I've mentioned because it hits aging from so many different viewpoints. If you had to just do one thing, if you only picked one thing off my list today, it would be to get a consistent exercise program in your life, because it's going to do a whole bunch of good in a whole bunch of ways that we'll talk about here. But number one, you're going to end up with deeper sleep. Okay. This is well known. If you exercise during a day, you sleep better at night.
Yep.
It's going to result in less inflammation in your body, assuming you're not doing extreme over-aggressive exercise, right? We like setting that aside. If you're doing, if you're walking 20 minutes with the wife, let's just say at night, something like that, doing a little lap swimming, a little stretching, something like that, you're overall going to be having a lower level of inflammation than you would otherwise in your body.
Yeah. If you're running an Ironman triathlon a week, or probably even once a month, probably not good.
No.
Too much inflammation, too much stress.
Yep. Promoting bones and muscle strength and development, obviously. Growth hormone release.
Yep.
This is fascinating for me. There have been studies done, and you talked about anaerobic activity, right? We've talked about anaerobic, strong stimulus for mitochondrial biogenesis and function. Anaerobic activity, strong stimulus for growth hormone release as well, Shawn. So I was fascinated when I first read these studies. They've done studies. They literally will have people sprint, go all out for just 30 seconds. And then they'll take blood levels, and you get a growth hormone release that's demonstrable for like an hour and a half after one 30-second sprint.
Wow.
Yes. Yeah.
Which just tells you that, we don't need a lot of exercise to get benefits from it. Something is better than nothing. So
absolutely.
Sprint for 30 seconds.
Correct. There was a few years ago, I had my personal exercise challenge for the year was to run a 6-minute mile. I was about 38, 39, something like that at the time. And I had not been a high school runner. I had never done cross country. I was not, a recreational triathlete, a road runner, none of that. So this was going to be quite a challenge for me. Like, golly, I'm 38 years old. I'm like 210 pounds. I've had back pain off and on in my life, and I'm going to try to run a 6-minute mile. Oh God, Here goes nothing, But anyway, I'm such an overachiever. I'm so just, determined about things. I'm like, I'm not going to let go of this goal. I said I was going to do it this year. I got to do it. Right. So anyway, the year's coming to a close. I got to run my 6-minute mile. Here's the thing, Shawn, I got to go to work. Right. I'm working hard. I don't have time to, get to the track and all this stuff. So how am I going to train for this? Here's the thing. You know how I train for the 6-minute mile, Shawn? I never went to the track one time until it was test day. What did I do?
Sprints. 20-second sprints.
I sprinted in place because, again, constraints and time and all that. I sprinted in place in my walk-in closet. Okay, sprinting in place, 20 seconds on, 10 seconds rest. Okay, typical HIIT cycle, typical Tabata, T-A-B-A-T-A for all you guys out there, right? I did Tabata HIIT cycles, sprinting in place. When that got too easy, I put hand weights on. When that got too easy, I held my breath. Okay? And let me tell you, if you've got 10-pound hand weights in and you're holding your breath and you're sprinting it like there's no tomorrow and there's a hungry, saber-tooth tiger coming after your backside, you will get in shape. And so it only took me about 10 minutes a day of doing that. I showed up at the track for test day. I ran my 6-minute mile. This was like 2 months of training, 3 months of training, something like that. That's it. Never went to the track. Sprinted in place with hand weights, with holding breath.
Yeah, I'm not surprised. I've heard athletes that do that, cycling athletes that do that, and they end up riding a 100-mile bike ride. And the only training they did was interval train like that for 20, 30 minutes at a time on the indoor trainer. Mm-hmm. And they finished a 100-mile bike ride. So lots of benefits from sprinting for sure.
Yeah. Yep. It's interesting. So in the original Tabata study, which is the last name of a guy who's a Japanese researcher, by the way, you can look this up. He popularized, it was revolutionary. It was really groundbreaking, right? Because he was working with Olympic athletes in Japan, as I recall. And these were cyclists. And so the concept was, what would be the minimal effective duration of exercise to get the same benefit, right? So if we, instead of having our guys cycle for 45 minutes at X intensity, could we have them cycle for 20 minutes at, a higher intensity? Could we have them cycle for 10 minutes at higher intensity than that? Right, and he just kept pushing the math and the logic. And he got it all the way down to 20 seconds on, 10 seconds off, pretty much max effort. So that's 30 seconds of work, right? Times 8 rounds Okay, so 30 seconds times 8, so that's 4 minutes. And he demonstrated in those 4 minutes, he was getting equivalent results from, I think, 30 or 40 minutes or something of a more low intensity traditional. But here's the thing. Here's what was a kicker to your point of the 100-mile bike ride. That's anaerobic activity. Okay. And I think they did calf muscle biopsies and looked at mitochondria. They obviously tested VO2 max and all that stuff. So you would anticipate, you would predict, okay, they're sprinting. They're going to obviously have a higher anaerobic capacity when they're done. So yeah, the Tabata group compared to the typical low intensity group, we're going to expect them to have a higher VO2 max and higher sprint capability. Yes, they did. That was obvious. That wasn't groundbreaking. What was groundbreaking was that their just normal aerobic capacity also increased greater than the other group. And I think the mitochondrial biodensity and something like that on their calf muscles as well. But the point was it actually improved both anaerobic and aerobic output greater than the other group. So even though the other group had a stated goal of improving aerobic capacity, the best way to prove aerobic capacity was this sprinting regimen that he put them on. That was the groundbreaking part.
In some ways, when we were talking about the science of the mitochondria, we shouldn't be surprised, because if, the whole, whether it be aerobic or anaerobic effects that you're looking for, when you, essentially, increase the output or increase the number of mitochondria in your cells, you're going to get benefit from anaerobic exercise. There's just no doubt about it.
Correct.
So that's the reason it works. Now, I will say this. It really throws a wrench into a lot of coaching strategies when it comes to endurance athletes. And honestly, Dr. Turner, I wish it was that simple, but I don't think it is quite that simple, because here's one of the things too. Even if you do have that aerobic capacity because you generated it because of the increase in the anaerobic intervals you were doing, so you increase your anaerobic interval. If you're not used to being on a bike for 5 hours and you've never actually practiced that, you get a mental breakdown when you get a couple hours into the ride. And it's like, holy smokes, I got 3 more hours of this. So it's not just physically, it's a mental thing. And if you talk to people that have done Ironman triathlons, I've got a buddy that's finished 15 of them and he's never DNF'd. It's all mental. It's kind of, it's not just physical. I think especially as the duration increases, it's really, really a mental piece. And think about why we call them endurance sports. To endure, you're enduring something. You have to. So that's why they call them endurance sports. So physiologically, it makes a lot of sense. But I think mentally, endurance sports, you do need some of that. And possibly if you were running more than a mile, if you were running a marathon, it would have been, I doubt the sprints that you were doing would have worked for a marathon. Because if you think about people that hit the wall at like 13 miles and stuff, I don't know if the sprints would help that. I really don't know. I'm just kind of guessing. I don't know. I would love your thoughts.
Good point, Shawn. And I like what you're saying. I think you're right. And I'll also add, I'll take you one further on that and say, part of it is physical still, right? In the sense that what we've talked about is to say that the cells and the mitochondria can get ready with an amazing aerobic output. That's all good. But you know what? When you're running a marathon or you're doing your triathlon or you're cycling 100 miles, you also have to remodel ligaments, right? Bones. You have to remodel 3-dimensional structure of your body to get ready to endure those weight-bearing forces for X period of time.
Right.
And that only happens with X period of time. Right. So you can get the cells and the mitochondria density ready to throw off more energy than you know what to do with. But your 3-dimensional skeletal structure isn't ready to deal with whatever it is for 3 hours until you're actually out there for 3 hours. So
good point. That's a really good point. That's why I asked you. I knew you'd know.
Well, thank you. Yeah. Right. That's a good point. Right. So it kind of saved my bacon. I had a 1 mile goal because,
Right.
my knee or something would have started getting twinsy, I'm sure, by mile 10, because I just wasn't ready for that. So, yeah. Yeah.
All right. So back to anti-aging. What
anti-aging exercise weapon? Yeah. Growth hormone release. Love it. Sprint it. Get it. Next up, heart and lung health. Right. So here goes exercise promoting heart and lung health. Obviously, here's one of my big faves: brain health. Okay. To exercise is to have a healthy brain. Those are both connected. In fact, I talked about this on some other podcasts that I've done. But this is fascinating to me, Shawn. They've done studies. If you exercise, you are immediately smarter in the post-exercise period for several hours. Immediately. They've done basically IQ tests. They've done tests where they'll give you random faces and names to two different groups of people. And then then one group goes and sits in a lazy boy and reads a magazine for 20 minutes. The other group goes on a stationary bike. They call them back in, they post-test them. What's their recall? The people who exercise have a higher recall. This is demonstrable. They've done many studies like that. It's fascinating. It's based on brain flow, essentially, or rather blood flow, essentially, to the brain.
It makes sense.
So, Yep. You're throwing the dimmer switch up to full circulation of blood, and your brain's gonna, thank you for it.
It's one of the reasons we don't exercise right before we go to sleep, because our body needs to decompress. It needs to, including our brain. Yeah.
The other thing that exercise is known to do for the brain is to promote levels of something called BDNF, brain-derived neurotrophic factor. And this is a fascinating molecule. Basically, in colloquial language, I would call this miracle grow for the brain. Okay, when brain BDNF levels are high, this promotes health of neurons and it promotes strength of neuronal connections. And we know that exercise boosts BDNF levels in the post-exercise period. So very healthy in that way. And then, of course, exercise is helping for mental health, stress relief, right? So all of these things are anti-aging concepts, or on the flip side, pro health and wellness, preventative medicine concepts here.